For this next video, I'm going to go ahead and demonstrate the nursing procedure for the removal of an ear impacted earwax. So it's basically built up earwax, cerumen, that's been clogged up, and now I will demonstrate the steps. So for starters, for the earwax removal, we do want to make sure we get everything that we need, and depending on the provider, we could use this one, the little squirt bottle with the tip at the end, or we could be using this syringe here. And then also we have the earwax removal kit, which are the drops that we also place inside the patient's ear from side to side. If we're going with this one, we follow the instructions and have the patient lie on their side for a few minutes, and then if the other side's also impacted, then we go ahead and also do that for the amount of minutes as instructed. So you want to make sure that you have warm water, nothing too cold and nothing extremely hot. So always go with warm water when you're using the syringes or the bottled water. Another thing I would like to point out is hydrogen peroxide can also be added to the water as diluted to help remove the ear. The very first step to do for earwax removal impaction is to wash our hands. Next, we're going to go ahead and review that physician's order. So like I pointed out before, they can order earwax removal drops. You could be using the squirter with the tip at the end, or the syringe. It is important for us to review the physician's orders because we need to know exactly which ear is impacted, because you do not want to irrigate the wrong ear. As nurses, you also want to note the amount, the dosage, and what type of medication and solution is ordered by the physician. As you get a hold of the ear medication, you want to compare it to the chart to make sure that is the correct one you are about to use. We want to make sure when we're comparing the chart to our medication that it is not expired, that it's the right medication name, the right dose. Next step will be to again wash those hands again, and then after that we're going to go ahead and put on gloves. Next, we're going to go ahead and enter the patient's room with the supplies and everything, and we're going to go ahead and introduce ourselves and explain the procedure, how it might feel to them, what to expect, so their anxiety is put at ease. Also take note of any known allergies that the patient recently has or has had in the past, because it could be contraindicated in the medication that we will be giving them. Afterwards, we're going to go ahead and obtain a sort of verbal consent from the patient. Take note to notify the patient if it becomes uncomfortable or painful at any point to go ahead and raise their hand so you can stop, or they can just state it. If you're using the drops instead of the syringe or the water bottle, then what you're going to have to do is read the instructions, and sometimes you have to shake the bottle. And when you remove the tip from the eardrop bottle, make sure it does not touch anything else besides the patient's close to the, and right before, you want to make sure that you pull back the ear and have them tilt their head on the affected side. And then with the tip, you're going to go ahead and get, make sure it doesn't touch the patient's ear, but make sure you instill the drops, the amount of drops as they have to have their head still tilted about 3 to 5 minutes to keep that position. If you're using the syringe or bottle, make sure you have like a towel on the affected side of the ear, or oftentimes you can get like one of those containers, the pink ones. I forgot the name of it. I think it's like it's essentially like a disposable container. You want to place it right around here and have the patient hold it. Then depending on the amount that the provider has prescribed, that's how many times you're going to have to irrigate the water. And then you usually have like a tiny little scalpel to kind of drag out the earwax if you can visually see it coming out of the ear. And this concludes the nursing procedure of how to remove earwax for the patient. Thank you.